Sorry for the interruption. There were some technical errors. I'm really sorry. So again, continuing with the pulpotomy, it is a vital pulpotomy and non-vital pulpotomy. The vital pulpotomy, it is of single sitting type and two sitting type. So in single sitting type is like the patient will be called in a particular day and we'll be actually opening the cavity. What happens is like we'll be removing all the infected pulp. On top of that, we'll be producing or placing a formicrosol. That is formicrosol pulpotomy. Next is electrosurgical procedure is there. So this is the two important thing that is commonly been used in the single setting. Two setting include the paste which is actually been used, the Trio paste is there, alexin formaldehyde paste and paraformaldehyde. So these are actually the paste that is used. Next is actually the preservation is there. Preservation include the glutaraldehyde again we'll be using, or the ferric sulfate is the most commonly. These two are not among the three. These two are the most important like preservative vital pulpotomy that is being used, right? So in which cases pulpotomy is not included? As I told, we have to do pulpotomy in those cases where the root length is more than 2/3 of the root length. That is very important. The tooth crown is non-restorable. In that cases, we cannot do. Hemorrhage is actually like we are not able to control the hemorrhage in that area. In those cases also, it is like continuous bleeding is there. In those cases, we cannot use a pulpotomy. And in TOP positive cases means there is infection in the periapical area. In those cases, we cannot use. And the radicular pulpal necrosis cases also, we cannot do. On radiographic examination, there should be no periapical changes. So formicrosal pulpotomy, as you can see in this image, the questions that is asked from this area is like, who introduced formicrosal? That you need to know Buckley. And what is the composition of formicrosal? It includes tricrosol, 19% formaldehyde, glycerin, and water. That is a composition that you have to keep in mind. So as I told, formicrosol has been used in a one appointment pulpotomy. So you can see in this image, we will be actually removing the coronal pulp is removed in the first image, as you can see. And after that, we will be placing a cotton that is immersed in the formicrosol and we'll be leaving the patient, right? So what is the concerns with formicrosol? This is again another question. What is the disadvantage of formicrosol pulpotomy? The toxin, it is actually considered as the toxic substance. It have actually toxicity is there. What is the type of anti-genicity is also been actually recorded in certain guinea pigs as well as rabbits, etc. It is often mutagenic and also cytogenic is also there. And two appointment procedure is actually not much of an indicator in formaldehyde procedure. Partial pulpotomy, the other name is chick pulpotomy that you have to know. What happens is like instead of removing the pulp, coronal pulp, so at last there will be small amount of coronal pulp and radicular pulp. Normally, pulpotomy we know that actually removed from the coronal aspect. That is called as partial pulpotomy. So you can see in this image, you can see the C image, a small bleeding is there indicating that some is as such. Complete pulpotomy, as you know, the complete pulp will be actually removed from the area. So what are the alternatives to formicrosol? We know that formicrosol is actually having toxicity, cytotoxicity and mutagenicity, etc. So instead of that, we'll be actually using glutaraldehyde. The same procedure, we'll be actually placing the glutaraldehyde on the surface of the directly on the radicular portion. So actually glutaraldehyde is having more of actually positivity when compared to the for toxicity, mutagenicity, and it is having more of actually bactericidal action. So the question might be like, which is the material that have more of an advantage when compared to the aldehyde and glutaraldehyde. It is of course low toxicity being present. So what are the non-pharmotherapeutic pulpotomy? That is very important. Normally they are of two types. First is the laser that is used, and second is the electrosurgical heat that is actually applied onto the surface. That is another important. Sometimes the question might be like, which is the most commonly used laser? Mainly YAG or YAG laser that is so what happens is like on superficial type part, we'll be applying the laser as you can see in the second image. So there will be coagulation taking place, and after that like there will be bleeding being stopped, and we'll be applying the restorative material. Ferric sulfide pulpotomy, similarly, we'll be applying on the surface as we told about the formocrosol pulpotomy. The mechanism is different. The ferric sulfate help in the agglutination of the blood protein. That is very important that you need to keep in mind. It is a similar procedure. Coronal pulp is removed and we'll be actually placed in the 15.5% ferric sulfide for 10 to 15 seconds, right? And you need to know sometimes high-fi questions might be asked for like option which is the current there, nano hydroxide apatite, enriched pulpotomy, calcium enriched material, enamel matrix, propolis is actually from actually honeybee, etc. Platelet rich plasma, pulpotech, calcium phosphate cement. This is the current concept. Just you need not study propolis to know. Propolis is actually a material that is extracted from the beeswax. Right. Apexogenesis. So apexogenesis is done in a vital, means the tooth. So similar procedure is actually done. The indication is similar. There is no history of pain or no infection, and no hemorrhage, no sensitivity to percussion. All this should be actually done. You can see the first image, the apex is open. After that, the apex is closed. This is actually apexogenesis. What apex closure is done, right? How we do a apex closure? Again, we'll be actually applying, we'll be opening the canal, we'll be cleaning the pulp, and we'll be applying medicament. Because of this medicament, there will be activation of the stem cells or growth factors at the lower area, and there will be apex closure taking place. So contraindication, as I told, if there is periapical lesion or like evidence of any radicular pulp or discharge or periodontal diseases, we cannot do a like apexogenesis. So again, one question that was asked for this PSC question is, what is Theracal? Theracal is actually again a calcium silicate filling material. But the good advantage of that is like it is light curable. Once we place on the top of pulp, we'll be curing it with light. So that is the advantage of Theracal. Biodentin we have already discussed. Okay. Again, two important things that you have to keep in mind is active, bioactive. It is again a light curable calcium silicate material which is used on the top of pulp. Endogmin is actually a protein that helps in actually the reparation of pulp. So very important thing is like uh, you need to know what are the differences. Direct pulp capping, indirect pulp capping, apexogenesis. Now, what is regenerative endodontics? Regeneration is like we'll be causing again the closure of this apex with the help of some growth factors, stem cells, and scaffold. This three triad has to be present in regenerative endodontics. So the question, pulpless primary incisor, you can see abscess caused by trauma in 4-year-old patient can be effectively treated by. So we know that till now we have studied pulpotomy, pulpectomy, apexification, and pulp capping, etc. all those cases, the pulp and periodontal area should be very perfect without any abscess. So in this case, we cannot do any pulpotomy. The answer will be actually pulpectomy. Pulpectomy means in entire pulp has to be removed. It is similar to that of root canal. The second question, the simplest form of pulp therapy, we know that it is pulp capping. It is mainly what indirect pulp capping, that the pulp is not exposed. Next question. The most successful treatment for a vital primary second molar with a large carious pulpal exposure. So the question is like, it is very large lesion. So the answer will be pulpotomy with formicrozole. We know that since it is actually exposed indirect pulp capping, why not pulpotomy with calcium hydroxide and pulp capping with calcium hydroxide? Because since it is actually primary tooth, we never do actually pulp capping with calcium hydroxide. Please keep in mind, it can lead to internal resorption. Some important point that you have to keep is like frequently asked question. See the last one, non-vital mature teeth. Non-vital means the tooth is dead. The mature means apex is closed. So just do a root canal treatment. See the next one, non-vital immature tooth. So what we have to do is actually apexification, because immature means the apex is not closed. So do a apexification. See the second one, vital, light tooth, immature tooth with large pulpal exposure. So do a calcium hydroxide pulpotomy. Vital tooth with small pulpal exposure, do a direct pulp capping. So these are some of the confusing area that is commonly and most commonly being asked. Please go through this. And thank you. Hope you had a very nice session. And if you have any doubts, please revert back, especially this topic, various differences is very important. So please keep in mind, go through the slides or go through the video once again. And if you have any doubt, please revert back. Thank you. Do a very good smart study. Thank you.